So the loss of this homeostasis in the maintenance of the healthy cartilage leads to a pathologic degeneration of the cartilage that happens in osteoarthritis. So the cartilage destruction is the central feature of osteoarthritis. However, we need to understand the complexity of the joint, and when the joint is affected by osteoarthritis, it's not just the destruction of the cartilage only. It's not just the degeneration and the chronic inflammation in the cartilage tissue, but it also the bone remodeling. It's the changes in the subchondral bone, sclerosis and appearance of cysts, appearance of osteophytes and because due to the overgrowth of the bone tissue and its attrition in that part of the bone tissue which is immediately under the cartilage. It's a capsular stretching and inflammation of the synovial sheath due to deformity, of course, and the chronic inflammation. It's the atrophy of the periarticular muscles, muscles that are covering joint from 360 degrees, basically, providing also partially the stability for the joint. So the atrophy of these muscles will further contribute to the osteoarthritis. Synoviitis and ligamentous laxity, so also contributing factors to the osteoarthritis. And if we look at the systemic causes that contribute and make that condition worse, of course, it's aging by itself, it's obesity, the extra weight providing extra pressure, the burden on the joint, any traumas in the past, especially the traumas which are reoccurring and the traumas which are not being healed previously in the past, excessive loading and a constant persistent damage to the cartilage due to the occupational hazards perhaps or physical activity. It's metabolic syndrome, so the diabetes, for instance, and dyslipidemia and all the changes in energy switches will further contribute to the development. It will feed the osteoarthritis, genetic predisposition, and gender and hormonal profile. So hormonal disorders will lead to weakening of the muscles, loss of the muscle mass that covering the periphery of the joint, and also it will further contribute to the bone remodeling and reduction of the mineralization of the bone. As regenerative medicine doctors, and if we want to apply novel treatment strategies, we need to understand the actual in-depth cellular and subcellular mechanisms that are occurring in the tissue, in the joint during the osteoarthritis. So, from the position of the modern contemporary medicine, the changes that are happening inside the joint include chondrocyte senescence. So chondrocytes develop the so-called SASP, senescence associated secretory phenotype. It's the predominant chondrocyte apoptosis, programmed death of the chondrocytes, plus the senescence of the chondrocytes and loss of ability of generating new naive chondrocytes. It's degradation of the extracellular matrix, subchondral bone dysfunction and tissue remodeling, chronic low-grade inflammation in the joint surrounding tissues, and muscle atrophy. If we look even deeper, we're having a mitochondrial dysfunction in the cells, the cartilage, increased ROS, reactive oxygen species, inability of that microenvironment to combat and offset oxidative stress. And that, of course, is caused by the pro-inflammatory interleukins, tumor necrosis factor, mechanical stress, chronic inflammation.